It's an honor for me to introduce Dr. Doris Grinspun. We were talking about, somebody asked Doris, does she know me? And Doris and I go back. She was one of my first bosses when I was like that was 100 years ago at Mount Sinai Hospital. And I was saying to somebody that, it was truly a privilege for me to very early on in my career to have Doris as a mentor. And she still continues to be a dear colleague of mine. And I'm really, really grateful for her presence here today. Dr. Grinspun is a trailblazer in the nursing profession and a powerful voice in advancing public health policy. As the CEO of the Registered Nurses Association of Ontario, she has dedicated her career to elevating nursing practice and transforming healthcare systems to better serve communities. One of her landmark achievements is the founding of the RNAO Best Practice Guidelines. It is a globally recognized initiative that has improved health outcomes and elevated the standards of nursing care worldwide. Her leadership extends beyond Canada, and she actively contributes to nursing initiatives around the globe. At Osler, we are proud to be a BPSO, and I've been a chief nursing executive in 2 organizations and have supported both organizations to achieve status. So Dr. Grinspun's career is marked by numerous leadership roles, including serving as Director of Nursing at Mount Sinai Hospital, where she played a pivotal role in shaping patient care and nursing excellence. She is also an adjunct professor and an advocate for global health equity, showcasing her commitment to education and systemic change. Her achievements have been celebrated with numerous prestigious awards, including the Order of Ontario in 2003, the Queen's Jubilee, Diamond Jubilee Medal in 2013, and the COVID-19 Courage Award in Policy in 2020. These accolades reflect her unwavering dedication to healthcare, equity, and advocacy. Today, Dr. Grinspun will inspire us by sharing the stories and successes that have shaped her extraordinary journey in nursing and healthcare leadership. Please join me in giving a warm welcome to Doris.
Here you go. I do want to say aspects that Tiziana didn't say that are actually probably representative on both who she is and who I am. And it's the retreats that we did in the living room in my office, in my home, but kind of office. That tells you something, right? Now I cannot do that, Shanoya, now because we are too many. In those days there, we were a small group. And yes, we plotted and planned together. And also that I had the joy to be at your wedding. And that to me is still very meaningful. So some of you, how many of you received the journal on the VPGs, on the VPSO? How many of you are nurses? Let's start there. Okay. Now, why are you sitting at the back? Come to the front. You see, I don't believe on elevating nursing. Whoever is writing that is powering nursing up. So here you go. Power you up to sit more in the front so I can see your beautiful, beautiful presence. So all of you that are nurses, whether RN, RPN, or NP, should have received this journal. Not to say that you don't need to be a member of RNO. You will see the code in a minute so you can become if you're not. But also RPNs and NPs that are members of RNO also get it. And also anyone that is not a member, as long as you're registered with the college, you got this. Unless you mark the college, no, I don't want to get anything. Here you go, mistake. And then this year, you are going to get about the VPGs, the program. In fact, we're working on it now, and it's going to come to you likely at around mid-March or so, to your home, to all the RNs, RPNs, and NPs in the province. So where do I see the slides here? Here. Okay, wonderful. So for those of you that don't know what's RNO, let me tell you a bit about what's RNO. And I would like to have that way closer to me, because if you think I can read that at this stage, but you know what? I know it by heart. So RNO is the professional association representing RNs and NPs in the province of Ontario. On the area of PPGs, we work with absolutely every nurse, regardless of the designation. On the area of policy, you will hear us speak more than about RPNs, about RNs and NPs. We do speak also about RPNs, and Diane Martin loves it when we do, right? Especially on issues of compensation and how that needs to improve for you. And what is important also is the mission of RNO, and Tiziana kind of summarized it, right? Healthy public policy, promoting excellence in practice, powering nurses to serve the public. And today is a unique day of powering nurses to serve the public and speaking out on policy, because unfortunately, a few minutes ago, the government released his new legislation and the decision to close all the safe consumption services. And that is outrageous, because it's against the evidence that the government received in the consultations and in the reports that they requested, and even against the evidence that the police says in sites where you have safe consumption sites, you actually have less violence than in communities where you don't. So please know that we will continue to push forward with the evidence, as we do for anything else that we do. I also want to share with you that both the best practice guidelines program and the policy work of RNO, all of them serve to advance the quintuple aim, right? So basically, the health outcomes of persons, organizations, and health systems, the experience of persons, and also of the system patients as a whole, if they, for example, get care in public health that is less of an institutionalized setting. And the cost of care also gets improved. Simply stated, if you have less pressure injuries, if you have less falls, if you have less transfers, as I was speaking with the colleagues in ER before, if you have less transfers to emergency departments, and people can receive care in nursing homes if they are there, or in their homes, the cost gets reduced. And then, of course, the experience of healthcare providers, all of you and others that may be watching online, or others that may not be here, but all of the providers, nursing and also other providers that are not nurses. It is critical that the experience that they have of providing care be a meaningful experience, be something that, even if they cannot finish everything at work every day, that for the most they can, and when they leave work, they feel satisfied about the care they provided, and that the care that they do is meaningful to patients, meaningful to families, to communities, and to themselves. So now comes the question about membership and soon the QR code. How many of you are members of RNO? Lovely, beautiful. So not only is important that you be members because you are well covered legally, and professional liability protection, which is mandatory with the College of Nurses of Ontario, and as you know, the renewal is coming up, is embedded in the membership. And that is from a few years back, 8 years ago, that we decided two things. Is when we were pushing already from 2012, we started to push for RN prescribing. Some of you may remember, and we got it now. And not only we got it, by the way, is now will be part of baccalaureate entry to baccalaureate programs. So it's starting in Ottawa in September, and it will move to other schools to be part of the baccalaureate program. And when you push for things that are so at the edge of practice, at the edge of scope of practice, and it's new, you want to protect professionals in the way they need. So we decided then with the board that we were going to move from a discretionary program to an insurance program that has a policy behind, and which means in terms of RNO, is that we have a duty to defend. It's not a question, will you or will not, will you take me or will not? You have the policy, and as long as it falls, as long as you have the membership, which has the PLP included, then what you have then is a policy and we have a duty to defend you. And have we paid big bucks for nurses because of major issues? Yes, we have. Yes, we have. And we have the backing to do that. And so that is the strongest insurance policy that exists for RNs and NPs in the province and also outside of the province, because some are from outside of the province. So that's critical. Second reason why it's critical to belong is the numbers. So when I moved from Sinai to RNO, first of all, just so you know, Tiziana, I never thought I will stay more than 6 years. That was my top before I kind of thought enough of this. Someone else can take it. I need something more challenging to move the world forward. Well, the sky became the possibilities, and you will hear tomorrow from Dr. Shanoya Naik, and you will see that the sky is even more than what we can dream with artificial intelligence and deep machine learning, and we are moving places that no one has been before. And yes, that's what we like to be, trailblazers of the future. So what numbers do is they actually give you the possibility to move policy. BPGs, I am less concerned because they're moving all over the world, as Tiziana mentioned, but moving policy that is the most out in the periphery policy is more challenging, because we don't take any simple issue at RNO. We leave the simple issues, the less complex issues, to others to move, and RNO takes the most complex, the most important in many ways, and the most challenging policies, i.e. EDI. And we are moving EDI places, and you will see in the BPGs that we have issued and we are about to issue. And then you have there the QR code. That QR code, for all of those of you that put the hand up, you can actually refer people, and you get rewards for referring people. Why? Because we believe that nurses, RNs, NPs, and many RPNs that are also members of RNO through Friends of RNO, or because they're in bridging programs, have a lot to gain from the association in addition to the BPGs. And because the more people we have, the more people and the more issues and the more policies we can move forward. So please make sure that you use that to your advantage and to the advantage of your profession. And that's a QR code for you to take a quick snapshot with your phone and start to refer people, because it will be really amazing if you do. I will wait for a second. So beautiful. You should take a picture of them. You should take a picture of them. I will get brownie points of my director of membership, who is Morgan Offert, and she's a nurse too. So yes, full circle. When I came to RNO, was a nurse. That nurse, I became her reference for the midwives, Kelly Stadelbauer. Then we had Daniel for 23 amazing years. And now Morgan is the director of membership upon Daniel's retirement. So that is critical. And if you think that I can read that, my gosh. So BPGs, so they put you this so far that here needs to be. In any case, so BPGs have existed since the proposal written in 1999, a simple dream of a much younger nurse, absolutely dreaming to make a difference. A proposal that Tiziana may not know the story, but I had a project when I was at Sinai with WHO, with PAHO. And then I went like a very young nurse and naive to the foundation of Mount Sinai to offer them to create something at Sinai. And they thought, does she come from another planet? nurses having an institute for evidence-based practice. And then, of course, I decided to move to RNAO, and the rest is history. I took the idea with me and Minister Whitmer, who is here featured, as is every other minister and premier, because all of them have supported the program. So we took it with us and then build that program. In the next one, what you see is the trajectory of the program. A tremendous trajectory. It doesn't help too much, so don't worry, it's all good. It's all here. The trajectory of the program from inception to now. But what you see there is on the right side at the end, you only see 2023. Well, let me tell you what happened today, that I am so inspired till no end. Today I participated up to before I came here in the first ever International Students Global Conference of PPSOs. So 10 of the schools that initiated the academic work on BPSOs, they organized the students themselves, no help from RNO, organized from the program to how it will flow, to the concurrent sessions, to the breakout rooms, to absolutely everything, including the marketing. And I tell you, it's just amazing, amazing, amazing what they have done. And for the colleagues of Colombia, you should see the students from Colombia, from 2 schools, and the colleagues in many other countries, Qatar, etc., doing tremendous work in their countries, including, of course, in Canada, with student champions of PPSOs. A New Frontier, 2024, they said we are the leaders of tomorrow. And I said to them, no, you got that one wrong. You are the leaders of today, building the tomorrow for you, I said, and for the people that you will be caring for. Because you know, what we do is prepare the next generation. Same for you in the practice setting. Welcome the next generation, prepare the next generation, let them fly. And another thing I said to them, and don't let anyone tell you you cannot do it. Don't let anyone tell you you need to move from the driver's seat to the back seat, because if I had done that, I wouldn't be standing in front of you. And because we need every single nurse to be in the front, in the driving seat with other health professionals for the sake of good care for patients and their families and our communities. So the VPGs, we have over 52 best practice guidelines, and we have several implementation toolkits. All of them are very good for you, all of them. In particular, you will hear today about the Leading Change Toolkit. We also have a toolkit on mental health and substance use, on primary care, on long-term care. All of them are good for you depending on your practice, and they're used with you in this program. And the program has 3 basic pillars from the inception. From the inception, when I clicked that button and went to Minister Whitmer, who had I think she had the generosity. I cannot say the wisdom, because she really didn't know how much we will deliver. She really, to me, deserves, and every year at the AGM, I say the same, she deserves huge credit. The other ministers, the other premiers, yes, but in a sense, it was already a path with proofs in the pudding. She went on it believing that what I had done with PAO, what I was saying will happen here, would happen, and it did. And of course, Elizabeth Whitmer today feels a great degree of satisfaction for having had the generosity. She thinks she had the wisdom. I think she had the generosity, but she deserves all of our respect. So does every premier and every minister since, because the program not only has maintained its funding, it has increased the funding to new programs as a request by government, and you will hear about some of them. So let me talk with you a little bit about, first of all, guideline development in a nutshell, like really 2 minutes because of time. But this is what we are going to London, Ontario. London, Ontario is celebrating their 10 years of BPSO. They're doing a massive conference about BPSOs, and we are doing concurrently also champions training and other activities. This is something you guys could organize on another time here. You are doing today already a piece of it. And with the research unit, you could build more. And congratulations on the research unit also. So in terms of guideline development, it is important that you understand that is at the highest standards of what guideline developments needs to be internationally, because there are international criteria, guideline international development at the national level. GENE guideline international network is called. We are members of GENE, and we follow all the international criteria that is requested. And then it has a full cycle and circle of who gets involved, and all of you have an opportunity to get involved. There is a site on the website that says if you want to get involved in guideline development, put your name for which guideline. The cycle of the guidelines, when we are developing new ones and you were doing the next edition, is there. You can put your name there. It doesn't secure that you will be selected, because we get hundreds of applications for every single guideline. And then there is also the review. So when we finish the development of a guideline, the guideline goes to external reviewers. There is an opportunity also there that you may want to think of getting involved. What does it mean following the standards? Basically, it means a few things. First of all, what are guidelines? They're simple statements. That's what it is. Statements, both in terms of recommendations and good practices, with great good practices that follow evidence. It's not statements out of a hat, right? Or by tradition of what you knew about the topic. It's based on the most relevant and actualized evidence on every single topic. And it means that we follow agree to, which is the tool which will tell you if a guideline is robust. And we follow all the elements of agree to, including that we need to disclose in the website who may or may not have a conflict of interest. And what we do is we actually post every single statement that the person put, and they know when they join that will be posted. Also important that you know that it needs to be completely transparent. There is no, black box that you don't know how the guideline was developed. That's all on the guideline. The entire evidence is there for you to review and so forth. Second, we follow agree, we follow GRADE. So GRADE is for the agree to is for seeing the quality of a guideline. GRADE is for rating or grading, that's why it's called that way, recommendations. So the robustness of recommendation is not based only on evidence. It's based on a few parameters, and I would recommend, if you're interested, that you look. For those of you that already are using our guidelines, so when you see the difference between how was done with GRADE, how we stand with GRADE vis-a-vis previously, please do not shrink or shy away when you see conditional recommendations. Conditional recommendations is no different than level 3 and 4 in the previous system. It's just that you didn't know what 3 and 4 means. But level 4 evidence basically means consensus. So conditional is exactly the same, and certainly they're very strong. The second thing, make sure that you use the latest edition of the guideline. So when you are looking at implementation here and you have been implementing for a few years, make sure that when there is a new edition, you move to the new edition. Otherwise, you may be missing some aspects, and that's critical too. Here you have that the guidelines are also translated into other languages. All of the guidelines are translated, of course, to French. All of the guidelines are translated also to Spanish, because we have a huge huge Iberoamerica consortium. The entire country of Spain is on the guidelines by the mandated by the government, and then many others in Latin America and in South America, and so they are also in French, in Spanish, and also there are many of them are in Chinese because China is a huge consortium too. And we organize the guideline in 9 different buckets, from foundational to all the aspects that you see there. So for example, for foundational, you have person and family centered care, right? The next edition, which is the 4th edition, meaning every 5 years, so picture how well we keep with that, of person and family centered care is coming out in February. The 2nd edition, which is mandatory, person and family centered care is mandatory for any BPSO, new or renewing BPSO is mandatory. And then transitions in care and services is mandatory also for any new or renewing cohort or BPSO. And transitions in care and services used to be called transitions in care, because the way we saw the guideline at that time and the scope of the guideline was in healthcare. Of course, with time, we realized, especially with the OHTs, that healthcare is an important component, but social services is too. So that's why it's called transitions in care and services. And the OHTs are involved, and you will see we're working with many OHTs, and we encourage you to join because they're getting outcomes that the CIHI and CIHR both are telling us, wow. Some of them were featured in an OECD report a few years ago, and Dr. Naik and myself were involved on that. Here are the guidelines that we're working on now. So we just released a guideline. We are releasing this coming week, the pressure injuries guideline too. And we are working on several guidelines, including the ones on EDI. 2S-LGBT we issued a few years ago. We are working on the guideline, and I hope it will be interesting to you. And please feel free to again put your name as a reviewer. We are working on the guideline of tackling systemic racism against Black nurses. It is a major issue here in Canada and in Ontario too. I'm sure it's an issue in this organization as much as we want to be spared of it. It's an issue in every single organization. And we are tackling at RNO also. And the other one is a guideline on suicide prevention for Indigenous communities. I had the privilege and the responsibility of being in a event with Indigenous communities, a workshop with 130 colleagues from our Indigenous focused BPSOs. And I knew of this. I knew of this because of policy, that suicide is a major issue amongst adolescents and children in Indigenous communities. I never expected 2 things. The tremendous challenge of hearing for someone that doesn't hear it every day, but once in a while in the news, because the news doesn't even speak about this. Every single day, one of those colleagues stood up and shared about the suicide the day before in their community. Not an attempt of suicide, a successful one. Nor did I expect, even though we have worked many years at RNO with Indigenous communities and peoples, that the generosity and the resilience of how they carry this with them, and how are they so not angry. They're not upset with us white people or colonialist people. It's something that we all should learn on how you build with resilience and don't give up on the fight. You know what I mean? Both sides. A tremendous important work. And out of a focus group that we did with them, we asked a simple question: at what age should this guideline, what age should be part of the scoping? You know, I expected 12, 13, 14 adolescents, right? They said to us, it needs to start at age 4. Why? And we ask why. Because if kids, young kids, don't hear, they normalize it. They hear in this family was a suicide, in this family, or they hear hush, 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 or they hear someone from the family committed suicide. Versus if it's out in the open, families can speak much more freely and get the supports that are necessary to start really preventing the thoughts of suicide, suicide ideation at that young age. What is beautiful of what we will do is that we will work parallel to guidelines on the suicide, and that was my conversation with the team. And yes, I still get very involved in direction, especially when it's very strategic direction. And what I asked Dr. Michelle Ray, who is the amazing director of the program, is that we work the mainstream suicide guideline with the indigenous focus suicide guideline separate, because this one is only with people from indigenous communities, but that from time to time they meet together to learn what are the differences and what are the similarities, if any, between those two guidelines. And then you can see a whole set of new guidelines, additional ones. We have added 7 additional people to the guideline development team. So we have now 14 people working full-time, all nurses, all RNs master prepared. You need to have a master's to work in that program. And in fact, in any program of RNO, it's very unusual that we will accept an RN that is not master prepared. We do have on clinical pathways program that you will hear a little bit. We also have a few RPNs because it's critical, because in long-term care, RPNs have a critical role. And we have RPNs serving as coaches and full-time employed by RNO. So then we move to, if this moves, we will see. Here you go, it does. Then we move to the next pillar, which is guideline implementation. And this is where you come to play big time. In guideline implementation, what you have is the BPSO and other initiatives. So I wanted to share with you about 3 levels. We work at the guideline implementation on 3 levels of intervention. So individual level, micro level, meso level, the organizational level, and macro level, the level of a health system. So Champions program, for example, can be done by people that are not in BPSOs, and that will be considered micro level. Champions program also, of course, is done in BPSOs, right? So that's part of the whole process of BPSO, which is meso level. It's meso level when it's one organization. Is more than meso level, regional level, right? When it's an OHT, because then it's a region. And it is macro level when it's a country. And that's the case of MinSal, the government of health in Chile, where the government runs the program, and the same with Spain. And that's where it's moving also to other countries like China, and to a certain extent here with OHTs, as we have more and more joining the program. So what's BPSOs? Well, the idea was the following. So we got the funding, right? Thanks to the generosity of Minister Whitmer. And I am pretty known for being a person that, first of all, will not share with the world anything until it's kind of perfect, except that they threw the door down from Spain and they say we need that. And also for being very accountable to funding. And I felt very strongly that we needed to know exactly what these BPSOs were delivering or not, in which guidelines they were delivering or not, what were the guidelines doing for person, organization, and health system outcomes. So it was like a lab, really. I perceived it as a lab. It's a lab where you will test guidelines and we will see how they result, and et cetera, et cetera. And then it occurred to us it needs to be more than the lab. And also I invited Tazim Virani, Dr. Tazim Virani, who also had worked with us at Sinai, to lead that piece because I had worked very closely with Tazim at Mount Sinai Hospital. She was leading quality improvement, all the CQI she was leading, and I thought who best than her. So my first conversation with Tazim in my office in the previous building, previous, was Tazim, what do you think of that? She says, it looks like a lot, but how do you know where we are going? Well, I said, we are going on this together, but here is the trick. Only one person, you and a support person and me. So we set the path and then we see if actually this will work before we use more and more funding. Again, being accountable, no different than all of you accountable for the funding that comes from taxpayers' dollars, right? So that we know what we are doing, and then it got transformed really into this mega movement that is the VPSO movement. From there, the goal is simple, is really to optimize. It's not anymore to test if it works because we know it does. And in fact, Shanoya and I don't often share the secret, but it's pretty known now to Ontario Health, so we may as well share ourselves that before a year, not 2, not 3, we thought it took 3 years before. At a year mark, the VPSOs are producing the outcomes. Some of them incredibly impressive outcomes. We have seen many VPSOs that use the pressure injury VPG, and after a year, they don't have level 4 or level 3 injuries, pressure injuries. So it's impressive. It's impressive from the human suffering of a person. It's impressive from the budget suffering of a health system. And it's impressive in how much nursing is powering up health systems to produce better outcomes. And I am in the Health and Safety Committee of Ontario Health, and I needed to call after that some of my colleagues at Ateneo because all I needed to say that I was smiling from here to here because I kept hearing from them that the QIPs mentioned BPGs. The QIPs mention BPSOs. The QIPs mention clinical pathways. And of course, Ontario Health knows about this. Ontario Health also is the one that requested us that we advance the second edition of transitions in care and services. So many times we do get requests from Ontario Health on which BPGs need to be brought ahead of the curve. And sometimes that may come from a public inquiry and other forums. So the goal of this, as I said, is optimize person or patients or clients or residents, however we call people like you and me that may need the system from time to time, organizations and health systems through 2 things: evidence uptake, evidence sustainability, and robust staff engagement. And that is where the BPSOs excel compared to many other organizations, as well as guiding how to use evidence in practice. And we do that at the level of local, right? Ontario, national. I gave you 2 examples, right? The government of Chile and the government of Spain. And us in many ways, we are involved with Health Canada in many other jurisdictions using the guidelines. We are in Nova Scotia, also with pressure injuries and others. And then internationally, when you see this event, not only the students, but it's just that to see students in second, third, and 4th year already speaking the language and leading a conference. I mean, it's like you feel that we have arrived in nursing. In fact, a colleague that was there that is not a nurse said to me, you know, when I saw this, and I thought, I'm not a nurse, but my gosh, I feel better now knowing where nursing is going. And that student, Julie Burris, she was saying, I feel so relaxed now. I don't need to worry. I say, well, worry about your health, but if you need us, we will be there. And then I want to share about the different type of BPSOs. So there are many types of BPSOs. What is important is for you to know that we progress on them based on what the field needed. We don't just invent models for the sake of it. It's what we call in the book, and I did bring a copy, and whoever does more social media, Tiziana will give them the copy tomorrow, because we do promote social media, especially now we promote social media. And the reality is that we call that in the book purposeful evolution, right? So we started with BPSO directs. Then basically Spain came to us and said, we need to translate these VPGs to Spanish. And we thought, quite frankly, naively, that all they wanted was to translate them into Spanish. Was a big hoopla at Areneo with Minister Deb Matthews that knew exactly how millions of patients and nurses and all the stats she had ready will benefit from Ontario. That's good. She was supportive of that. And then as soon as we signed, Dr. Maite Moreno turned to me and said, and now we need you to come and develop for us BPSOs. And I turned back and I said, you got it wrong. Now we will develop a model by which we will train you to become, to lead BPSOs in your country, because that's the right thing to do. It's what's called sustainable development in international work and in international development, and it's the best way, because then instead of charging money, which we don't, what you do is you charge commitment, and you tell those governments that they need to put, in order to enter the program, they need to put resources so that the country will succeed in the implementation. And that is what is in the contract of every single country. If some of you work in other countries or have family in other countries and you go to visit from time to time, please connect with us. We have many countries that are joining new, some because they approach us. Nigeria is joining this month, and Nigeria is joining because the chief nurse in Nigeria requested from us, and Dr. Michelle Ray and Dion Sinclair from KMH will be leading that, and I will be in the background just helping them, and then they're flying with them, flying literally and also with the program across the entire country. And we have Brazil joining, and we have many other countries. So if some of you work in other countries or have family back home, please connect with us. And then we have the new kid in the block, kind of. It's not anymore new kid in the block, which is OHTs. And we have, I believe, 12 OHTs doing magnificent work. And our colleague, Kristen Campbell, and a team are leading those OHTs forward. And you will hear soon the first conference for OHTs, led by OHTs, with our team in 2025. And that should be a learning for everybody. And of course, OHTs that are not BPSOs also will be welcome to join. The ones, though, that will be presenting are the BPSO OHTs. So it's beautiful work that they do. And we have 3 consortiums, and you can look at that in the website. Now, RNO doesn't wash their hands. When we have a BPSO joining, whether it's national or whether it's international or whether it's from Ontario, whether it's OHT or whether it's whichever type, academic or service organization, we have coaches, dedicated coaches for them. Who is your coach? Who is your coach? Javier. Fantastic. Javier is an amazing coach. And Javier is actually with the students as we speak now. And Javier is also starting a PhD. I was saying the other day to myself and commenting to a colleague, what are we going to do? What have I created? This is a monster what we have created. Everybody wants to go or do their PhD. Where are we going to find the time for them? We have numerous colleagues that are doing the PhD or starting the PhD, and numerous that are already PhD prepared. And it's what I always call RNO a scholarly professional association. Not that if you don't have a PhD, you cannot come, but master's is a must. And if you're RPN, Not that I want to steal anybody, but clinical pathways is absolutely a place where you can participate. So we have a very structured system for the coaches, and we all follow the same path. I am the coach for all of Iberoamerica, and which is the Latin American countries and Spain. And I already have leaders that are certified trainers of RNO that run the show by themselves. I just keep an eye on them. And they consult with me ongoingly, and we meet and train forward. And the same will happen more and more here, because we are growing at a pace that unless you develop those formal trainers and those certified trainers of RNO, it's impossible to do it without charging. And we have no intention of charging. Knowledge is from human beings, belongs to human beings, and is to be distributed for the good use of everybody. So very good, almost there. So here is what you have in terms of so that is the structure that you have. And ideally, I hope that Tiziana and the colleagues in the BPSO program have shared it and should share it every month or 2 or 3 with staff nurses, so new people know about the program, not through the leader or the founder of the program or the leader of Enquire, but actually through your leaders in your own organization, and I'm sure they do. And so train the trainer. This is what it is we train the lead coaches in every country. We serve as coaches, and then you disseminate to others. And I'm sure it's part of your performance appraisal, as is in most BPSOs, and also part of the recruitment of new staff. Most organizations do ask these questions at the recruitment level, and that's what prepares so well nurses to know what's expected, especially that all of you are aware of the program, so that shouldn't be a challenge. And then, of course, the 2 frameworks, the knowledge to action framework and the leading change, the social movement framework, both working in synergy, right? For accelerating change. This is all on the website, how you create the sense of urgency, how you create and build collective identity. I see many of you with the pin of champions, for example. Thank you for doing that. That is collective identity. I would suggest that you that are members of RNO use with pride your RN pin or your NP pin. If you are RPN, use your RPN pin. That is called collective identity. And it's really important for patients. I'm sure more than once patients will ask you, what does it mean, champion? Right? And that's really good to educate patients that nurses in all categories, we work based on evidence, and other health professionals that we work together with them also work based on compassion and based on the best evidence. So please wear that with pride and look at the website for details on the framework. There are a few articles for you to look. So we have BPSOs in all sectors. I'm not going to go in detail, but you have them in long-term care. You have them in mental health and substance use. We have also the clinical pathways, which are phenomenal. And we also have them, and I'm going to run in indigenous communities, indigenous focused BPSOs, and we feel extremely honored to be able to have those. So I will send the presentation in PDF for you to glance over, and there are many QR codes that you can look more in depth after. The indigenous focus BPSOs, I told you about the program in Thunder Bay that we had, and Mama Wasing is the first BPSO OHT that is indigenous focus, and they're doing incredible work in addition to the direct. So all in all, we have also programs to educate. Not only we do that through BPSO and coaching, we also do many webinars, all of them free of charge. They're all in the loop, the one that you get every week. Glance what's coming in terms of webinars. They're all free of charge. Join them, you get a certificate. They serve you for the College of Nurses, ongoing education, right? But they more importantly serve for you and for the people that you care for. And we have people attending in large numbers. ACPF, I hope that some of you have applied. Did any of you apply to ACPF? Lovely. So you can share with colleagues what ACPF means. Again, we give funding to the organization where you work, and we will do that for you if you apply. It's not a difficult application. There is 4 streams, EDI being one of them, and there are other streams. Feel free to apply, and there is for this year, up to March 31st, still 9 that have not been given away. Well, I shouldn't be saying because I don't know as of today, but go to the website, do it, because if you meet the mark, then you will be the first for the next round. So it's a tremendous program. It gives you space to breathe. It gives you space to put more knowledge into the toolkit that you have, that toolkit here. And it gives you space to come re-energize and share with colleagues. And what's your name? And Carla can share with you if indeed what I said is true or not. And if not, she will tell me how to make it better, and that's fine too. I'm going to run through the rest because I want you to look at this, and I do want you to look at the QR code and take a picture. That is to the credit of Dr. Shanoya Naik and her team with China and Fatima and others that develop a geomap. This geomap gives you where are all the BPSOs anywhere in the world and what BPGs they're implementing. And is impressive because then if you need a speaker for something that is interesting and you want someone from outside, you don't need to ask RNO. You go there and you will find that. It's really very inspiring, and it's on the way to doing something bigger that we will not announce before it gets done, usually, right? So implementation, I know that Dr. Naik will go in details tomorrow, so let's do that very, very fast. But I do want to talk about Enquire. So Enquire started in 2012 before Dr. Naik. And Tiziana, you will laugh about this and not be surprised either. When a colleague of mine, and I will say it because I have huge admiration for her, Dr. Linda Bryan Palas came to meet with me and said, Doris, this should be happening at U of T. This shouldn't happen in RNO, really. This is academic work. And I said, absolutely not. This is about our program. We know what we are doing. We will build it here because this will go so much further if it is part of the professional association that serves people both in this country and already was starting the talk about around the world. I didn't know this big, but I knew this is moving ahead, whether we want or not, because of, there are no boundaries between the world now. And so we did it at RNO, and she was a bit involved, but many others were involved. And Monique Lloyd, Dr. Monique Lloyd, who came to RNO close to that time, I think a year before, actually became the lead person with me and others for Enquire, and the rest is history. Then Shanoya Naik joined and many others. And we have a tremendous international advisory with the brightest minds. John Lavis from McMaster Forum is the co-chair with me. I would say he's the co-chair. I am just the host. A brilliant mind, Dr. John Lavis. Dr. Amelia, the head of WHO, is there, and many other brilliant minds, including all the mega data organizations in Canada, CIHR, CIHI, and et cetera. And they meet with us 3 times a year, and all they do is give us advice. But as they give advice, all the time they push for more. And of course, we are not surprised. They say, we know that you will deliver and will deliver more than what we ask. And indeed, I am presenting in an international event this week for Canada to the world with John Lavis and others. So wrapping up now, you have the outcomes. And the outcomes are incredible in any single BPG, and you also will see yours because we ask permission. And you can talk tomorrow during the break or today during a break on how you can create more, how you can build with other countries, etc., through the evidence boosters manual that was developed by RNO. So here are the champions and the collective identity. You can see it everywhere, and I'm sure if I work through your units, I will see the same as when I walk through the units of Humber River recently and other organizations that you can see PPSO well and alive in all the units and everywhere. I would love to see Tiziana next to that accreditation thing there. And this is not my idea. This comes from Montfort Hospital. Credit is where credit is due. They put next to it the BPSO, big time, and it looks magnificent. And we always take pride of Montfort with that. So collective identity, whether it's the pins that you are wearing, whether it's banners, whether it's in the units, whether it's showing the outcomes. There is a lot of pride on showing the outcomes. And here is more, and I want to get to yours because you need to see yourself. So that's in different countries, of course, and more growing, but let's move to you guys before we wrap up. Here you go. You are leaders. You are leaders. Did we skip one? No, this is the students today. I succeeded to plug them in before I came here because I just feel that the future is bright when you see that. So here is your leaders on your BPSO and the work that they're doing. And please thank you to the three of you leading this. And to the others, to the others that are participating. Wait, here you go. I hope some of you are here. Thank you again for the work you do. And look at your outcomes. Again, with permission. We ask for permission. Look at your outcomes. Look at your outcomes. And here is the story. Location matters. When I look back now, did it matter that it's at RNO? Yes. Why? Take one example, a progressive organization. So we lobby for safe consumption. They were called safe injection sites by then. That evening when we succeeded with the Toronto Public Health Unit and others, David McEwen calls me. Now we need the best practice guideline. I said, beautiful, you will be the co-chair and we will invite insight because what do I know about safe injection services? And he accepted and that became a BPG. And you see intertwined policy and evidence-based practice. And that can only happen in a professional association that is forward-thinking. You can look about cutting edge. We don't provide only the guidelines, right? We provide all the buckets and each one is leading edge. We don't oblige people to stay. In fact, if we see that they don't progress and deliver, we're not saying deliver top. We're saying that they report, that they actually follow what is expected. We actually very gently give them 6 months. And yes, we have taken out some organizations. Few in between, because it's not our goal, but we are very serious about the program. And of course, here is the book. Those of you that do social media today, tomorrow, actually, Shanoya is here tomorrow, so she can give you the book. Thank you. Thank you very much.
Thank you.
But you can.
Yes, I can give it out. I just want to thank, very quickly, I want to thank everyone for joining online, as well as for everyone coming here. Doris is always inspiring, and it takes more than an hour to talk about the work and the leadership that you bring to the RNAO and what you've done globally to mobilize and build a platform and the infrastructure to advance this scholarly work. Just incredibly impressive as always. And I know that the impact that it's had from an interprofessional perspective at Osler and the impact it's had on our patient outcomes, and you've given us an example there. So I just want to say thank you for spending this time with us, and I appreciate everyone being here today. So thank you.